My name is Dr. Gareth. I'm one of the consultants at Jacaranda Maternity. So basically this is a session for answering live questions in case you have any burning questions that you'd like the answers to right now. We've already had a few people write in with their questions beforehand, so I've got a list of those questions here. So we'll get started with those questions, but as more questions come in, then we will answer your questions going forward. Okay, so thank you. So I will get started. Now, unfortunately, I don't have people's names who asked the questions, but the first question is, hello, I'm having mild cramps on and off and numb hip joints at nights, and I'm just 4 months. Is that normal? Okay, so basically, sometimes cramps can be normal in pregnancy. Generally, what happens is when you're pregnant, your body changes in many different ways. So it's not just the bump. Also, your hips get wider and your back changes a bit of shape as well. So generally, sometimes a little bit of mild cramping pain that you might get in your hips and a bit of numbness at the top of your hips is also quite normal in pregnancy as your body changes in many different ways. If you have cramps in your tummy where your womb is that feel like period pain, then you might want to come and see us if you're pregnant and you're having period style pain. But if it's just cramps in the hips and things like that, that's probably just part of your body changing. Also, if you're having cramps that are associated with bleeding, if you have any bleeding from the vagina at all, then you're going to want to come and get checked out and make sure everything is okay. Right, the next question is a statement, and it says, I am a first-time mum and I'm so scared. So that's normal. It's really normal to be anxious about what's happening to you and about your baby in pregnancy. So we don't want you to be scared. We want you to come and speak to us and tell us what you're worried about, because we know a lot about pregnancy and we know a lot about delivery, and we're really able to help you with any of your anxieties that you might be having in pregnancy. The other thing that we have as well is about 4 or 5 of our staff members are trained counsellors as well. So if we identify that you have a lot of anxiety and it's maybe going beyond what might be normal for pregnancy, if you're having some really bad concerns and you can't sleep and that sort of thing, we have trained counsellors that you can see here, and they can support you through your pregnancy as well as your midwife and your gynaecologist as well. So we're really, really happy to help people that are very worried about their pregnancy, and we can answer any questions that you might have. So if you have any really big concerns, then just come and find us and we will talk. So the next question is, how many weeks can I know the baby's gender? So typically we do what's called an anomaly scan. So you have 2 routine scans in pregnancy. Your first scan is called your dating scan, and this is why it's so important to get this booking in early. So when you find out you're pregnant, it's very important to let the hospital know that you want to book your pregnancy out as soon as possible, because we want to do this dating scan. So the dating scan occurs between 8 weeks and 12 weeks, or depending up until 14 weeks, 11 to 14 weeks, so somewhere in the first trimester. And at that point, we do a scan to find out what your true due date is, because sometimes, although your periods might be regular, your actual due date is different. So the scan that you're having, that first scan, around about sort of 9, 10, 11, 12, 13 weeks, around there, is a really good time for us to find out when your baby's due date is and to make sure the baby looks normal. But you can't find out the gender on that scan. The next scan that everyone has is around about 18 to 22 weeks, and we call this the anomaly scan. And on there, we're looking to see that the baby looks normal, that the heart is normal, head is normal, spine is normal, that all of those things are normal on that scan. And also, yes, we can look at the baby's genitalia and tell you if it's a boy or a girl. So the earliest you can usually find out if it's a boy or a girl is around about 18 to 22 weeks. If you have the scan earlier than that and you try to find out the gender, sometimes the baby's genitals are not very visible at that time. So you may end up paying for a scan that isn't telling you what you want to know. So you're going to want to have a scan around about 18 to 22 weeks to find out not just if it's a boy or a girl, but also to find out if the baby's absolutely well and everything's okay. So it's the next thing. It says what to carry on the day of delivery when going to the hospital. So this is an important question. So for the weeks before your baby's born, you're going to want to be collecting things like baby clothes and baby hats, and nappies, those sort of things. Those are the sort of general things you want to bring with you. And lots of people bring sort of blankets as well for their baby too. We have blankets here, but people like to bring their own stuff. There's a few things that is also important from our point of view, is we want you to bring all of your pregnancy notes with you, because we need to be able to see what everything has been said about you in the pregnancy. So we have a computer system where we write about you, but also we write things on your maternity book. And so we want to get all of that information together. So when you're coming to see us on the day that you're having your baby, make sure you bring all of your maternity notes and also all of your scans, because we want to see all of the printed copies of your scans to make sure that we're very happy with your due date and all these sort of things. So you want to remember that. What not to bring is important, is that in Jacaranda Maternity, we provide food for you. We don't want you to bring food from outside. A few years ago, we had a situation where people were bringing their own food in, and then somebody got food poisoning and wasn't very well. So we want to make sure that the food that you're having while you're with us is food that we've cooked, that we know is really, really good. But generally, when you're coming, bring your phone. Also, bring some stuff to do, because sometimes if you're having an induction of labor or you're having a long latent phase of labor, you may find you don't have your baby on the day you think you're having your baby. So it can sometimes take some time for you to have your baby. So you want to make sure you've got your phone and something to do, because you may be waiting a little while for your little one to arrive. Hopefully that answers your questions. The next question is a very hard one. I'm not super sure I can help you with this one. It says, what can I do to conceive a baby girl? So the answer to that question is not a lot. You'll read things on the internet saying that if you conceive your baby in certain positions or certain times of the month, or if you eat certain foods, that it's going to increase the chance that you have a girl or a boy. So the first thing to say is that the gender of the baby is determined by the male. The father of the baby's sperm is what determines whether the baby will be a boy or a girl. So there's nothing that women can do to change that, and it's also true that there's nothing that men can do to change that too. It's an absolutely random thing, and there is no really good way to naturally try and have a boy or a girl. So I'm afraid I can't really help with that one. Generally, I would just say have a boy or a girl, they're both equally good, so don't worry about that. So then another question. We have lots of questions coming through, which is great. So if I gave birth through cesarean before, can I be able to have a normal delivery in the future? So there's a yes and a no answer to this. So when it comes to women that have had a cesarean section with their first baby, then in their next pregnancy, it's possible to deliver the baby normally, and we call this a VBAC. So a VBAC stands for vaginal birth after cesarean. Now, what that means is women who are planning to have a VBAC need to be risk assessed. So what we need to do is look at your previous pregnancy, find out why you had a cesarean, find out if the cesarean went well or if there were complications, and find out what the other risk factors are for having difficulty delivering. So for instance, if a woman had a cesarean before, because she was, everything was fine, she was progressing in labor, the labor was going fine, but then the baby wasn't enjoying the labor and they had to stop the labor to do the cesarean, then that means that the last cesarean was done for non-reassuring fetal status. It was done because the baby wasn't happy, not because her body could not give birth. Other times there are women whose babies are completely happy in labor, but actually what happens is the neck of the womb doesn't open, the cervix doesn't open, and so they have a cesarean because of failure to progress in labor. So we look at those two things separately and say, why did you have a cesarean last time? If it was because the baby wasn't happy and actually your labor was going fine, then it's possible to try and deliver the baby normally. But if it's because your cervix didn't open, the chances of you being successful at having a vaginal delivery is much less. There are some risks associated with VBAC, which if you come to the clinic, we'll talk to you about. But it is possible to have a vaginal birth after a cesarean. So if you had a cesarean for your first baby, it's possible to deliver your baby second time via a normal delivery. However, it's got to be something that's carefully discussed with the consultant in the clinic. So if you're booking your pregnancy at Jacaranda, please come to us and meet the consultant. We'll have a long chat about if VBAC is right for you. What I'm going to do now is move on to some of the newer questions, because people are asking live questions, but we still have some other questions from before. The first question is, I want to know if it's possible to be induced at 39 weeks. So that's definitely something we can talk about. So generally what we do is, if we have a medical reason, such as very high blood pressure, or some unusual things like obstetric cholestasis, some other medical reason to induce, then we will induce. So yes, we will induce at 39 weeks. If we don't have a medical reason to induce, you are fine, the baby is fine, everything's okay, then we usually like to induce you after your due date, because the longer you wait after the due date, up until 41 weeks, your chance of having a normal delivery is higher. If you induce people before their due date, the chance of them having a normal delivery is less. So it's one of these things that we can talk about. Some people have really good reasons why they need to be induced. So if you do want to be induced earlier than we think we would plan to do, come and speak to us and we'll have a chat about the risks and the benefits. But generally speaking, induction is needed sometimes, and it's fine if you have to have an induction. But actually going through labour naturally without medical intervention is usually a bit faster. So many women don't want to be induced for no reason, because it means their baby might be a little bit longer. So it's just one of those things that we can discuss. If you really want to be induced at 39 weeks, please come and we can have a chat about it. The next thing is, it normal to feel pain 3 months after a cesarean on the inside? So the answer to that question is probably. Unfortunately, what sometimes happens to some women who have a cesarean section is that they form quite bad scar tissue inside. So you have the cesarean, your recovery after the operation is okay. It takes about, 4 to 6 weeks to feel normal, but some people feel that they're still having pain after 6 weeks after a cesarean, and it can be because of adhesions forming. So if you cut your skin, you'll see that you get scar on your skin. The same is true inside. So if you do an operation, scarring occurs inside as well, and so sometimes that scarring can cause problems for you. It's something that's difficult to manage, but usually over time it gets better. So it's not something we have to be too worried about. If you're really worried about pain in the scar afterwards, you can come and see us. We can make sure the scar looks normal and think about doing a scan to make sure the scan looks normal, and then we can have a chat about how to manage the pain. The next question. I have finished my Preganine and IFAS. Is it okay to take them at the same time? So it's not harmful. So if you're taking Preganine is like Pregnicare, it's a multivitamin you can take in pregnancy, and IFAS is like an iron supplement. It's good to take them spaced apart. So if you can take the IFAS at the beginning of the day and the Pregnicare at the end of the day, that's probably best. The reason is the IFAS is going to be absorbed better if it's taken alone. So you want to take IFAS with orange juice. That's the best thing. So when you're taking IFAS, drink it with orange juice, or maybe just some water with a bit of lemon or something like this, because vitamin C is in lemon juice and vitamin C is in orange juice, and vitamin C helps you absorb the IFAS. However, the Pregnicare also contains other things like calcium and zinc, and sometimes the calcium and the zinc interfere with the iron absorption. So generally, if you finish taking those medications and you still need them, you should get some more. And if you're taking them, it's best to space them by a few hours to make sure that they're all giving you the best absorption. And so remember, with IFAS, you want to take it with orange juice or something with vitamin C, and also you don't want to take it with Kahawa or chai. Kahawa or chai, they stop you absorbing the iron as well. So vitamin C is good, coffee and caffeine are bad. How long should I start working out after cesarean section? So you can do gentle things, gentle walking and things like that after a cesarean. In terms of actually going to the gym or doing something really, really physical like running, you might want to wait up to 6 weeks to do that. The reason is sometimes it's just too painful, and you'll have the scar there. And so generally speaking, you want to wait a bit of time after, at least a month after having a cesarean, until you're not requiring painkillers, that you're not feeling at all unwell, and then you can try and do some more vigorous exercise. But generally, walking is always good. You can always walk. That's absolutely fine, but don't do any abdominal crunches or anything. You've just had an operation on your tummy. It's not a good idea to do any really vigorous stuff. And also remember that when you've had a cesarean section, you shouldn't drive for 6 weeks afterwards as well, because if you're driving and you need to do an emergency stop, it can really hurt you and hurt your cesarean scar. Okay, so the next one is question 6, and it talks about vaginal discharge in pregnancy, saying that you're having too much discharge and that you've checked for infection. It's not an infection and it's bothering you. So this is very common in pregnancy. You do see changes in your amount of your vaginal discharge. So when a woman is not pregnant, your hormones cycle. So when you're having your period, your female pregnancy or your female hormones increase and decrease throughout the month. And you can notice changes at different times in the month with your vaginal discharge. However, in pregnancy, what happens is the pregnancy hormone levels go really, really high, much higher than when you're not pregnant. So these female hormones can cause changes in your vaginal discharge. If you've been screened for infection and it's not infection, then usually it's not anything to worry about. It's frustrating. You might have to wear pads if it's causing you a problem, but generally speaking, it's not so much of an issue. The only time that's really an issue is if you notice something suddenly changing. So your discharge has been the same for weeks, and then suddenly there's a lot more. Because if you really worry that there's a lot of vaginal discharge and it's suddenly getting much, much worse, you might need to come to the hospital for us to check what's going on. Because sometimes increases in vaginal discharge can relate to the cervix changing and possibly early labor. So we want you to not worry about it too much. If there's a general increase, that's okay. But if you notice suddenly on one day that you're very wet all the time, and it's constantly you're constantly having discharge or water leaking, then we need you to come to the hospital to make sure that you're all right. So many more questions. Okay, so this question has come up quite a few times in some of the other questions we've looked at as well. So I might spend a bit more time on this one. So this one is, I have a problem of conceiving and I'm using fertility tablets without any success. Okay, so this is a big question. So when it comes to women trying to conceive, there is about a 5% chance you'll have difficulty getting pregnant. It doesn't mean you're not going to get pregnant, but it means that you're doing everything you should do and you're not conceiving, okay? It's a very common problem. 1 in 20 women have this problem. So you don't have to feel, first of all, that there's something wrong with you. But the difficulty is that you need to come and see a gynaecologist. Now, you can come to Jacaranda and see one of us. There's 2 gynecologists that work here, 2 consultants. There's myself, my name is Dr. Locke, and there's another consultant who's called Dr. Doreen Osoro. She's fantastic. And she is also a consultant gynecologist. And it's important that you see a gynecologist if you're having difficulty conceiving. Now, the first thing to say is that many times women will try to get pregnant for 6 months and they don't get pregnant and then they decide, I have a problem. That's not true, okay? So generally speaking, when it comes to healthy, normal people, any woman who decides I'm going to get pregnant, if you had a healthy woman who had no fertility problems at all and she and her husband decided to have a child, then they would have intercourse for up to 1 year, and in that case, 9 out of 10 of them would get pregnant. Okay, so if you had 2 healthy people with no fertility problems trying to get pregnant, 9 out of 10 of them would get pregnant within 1 year, and 1 out of the 10 couples would not get pregnant. If you wait again another year, so they try for 2 years, then around about 96% of couples will get pregnant. So that means there's only about 4 or 5% of people who actually have fertility problems. 95% of people don't have fertility problems. So it's important that you don't put a lot of pressure on yourself. If you've decided this Christmas, I'm going to stop drinking alcohol and I'm going to start trying to get pregnant. And by the following Christmas, you're still not pregnant. There's nothing wrong with you, okay? It can sometimes take 1 to 2 years to get pregnant, and that's normal because unlike other animals like rabbits, we don't have great fertility compared to other animals. So for human beings, it can take up to 2 years for you to get pregnant, and you shouldn't go running into seeing a gynecologist. You shouldn't go and start taking fertility tablets. The person who wrote that question said they're taking fertility tablets to try to get themselves pregnant. But the issue is, have you been properly investigated? Because if it's taken 2 years for you to get pregnant and you're still not pregnant, you do need to see a gynecologist, and that gynecologist has to arrange a lot of tests to find out why you're having difficulty conceiving. Fertility tablets only help in one kind of infertility. There are about 4 or 5 different kinds of infertility. So if you have one of those problems and you're taking these tablets, you're taking them for no reason. So it's really important that you come to see a gynecologist and have a discussion where we can investigate what's going on. Now, many women have already had those investigations and they're still having difficulty. So if you want to come and speak to us and show us the reports you have from other hospitals, what you've been doing, how things have been going, we can interpret those things for you and explain exactly what they mean so that you know how to proceed. Typically speaking, if you are looking at 100 women who want to have a child, 98% of them will be able to have a baby, and about 2% of people will have real difficulty. But it's really important that you figure out if you're in that group so that we can talk and figure out how you're going to start a family. All right. So generally, there were lots of questions on conceiving, and it causes a lot of anxiety. But the first thing you need to do is that if it's taken up to 2 years and you're still not pregnant, just relax. You probably get pregnant. And if you still 2 years after trying, you still haven't had a baby, then come and speak to someone. But a lot of the times you're putting a lot of energy in and a lot of stress, which is kind of making things worse. Our clinics at Jacaranda have gynecologists, but soon we're opening a new hospital in Ruaka. And Ruaka is going to have a dedicated clinic day. I believe it's going to be on Thursdays, but we haven't figured that out yet. But in the new hospital, we're going to have a women's health clinic. So this is a specific clinic for women who aren't pregnant or who have extremely complicated pregnancies, but that's something else to talk about later. But generally, on those special days at Ruaka, we're going to be having women-centered clinics, which are there to talk about fertility issues and also to talk about women's health issues, things like painful or heavy periods, and try to manage those things because those things are really important and they probably don't get enough attention. So the next question, it links onto that one, is do you do fertility tests? So we can order some fertility tests here, so we can do some blood tests and send them off. Our lab and our hospital does not actually have all of the equipment for doing those tests, but we have links with other hospitals who do those tests, so you can come to us, see our gynecologist, we can order the tests and send those tests off and then get the results back. So we don't have fertility tests in the hospital, but we have links to other labs where we can get those tests done and then we can interpret them and manage things appropriately. Right then, this is lots more fertility questions coming up now. So the next thing is, I have blocked tubes, what is the next step? So one of the causes of infertility is because the fallopian tubes are blocked. So generally, you probably already know this, but you'll have your womb in the middle, and then you have your 2 ovaries on either side, and then you have the tubes that connect. So when the egg is released every month, it goes through the tube and then into the womb. Sometimes these tubes are blocked. Now, what needs to happen is you need to have a HSG. A HSG is it's a medical, long Latin sounding thing, or Greek thing. Stands for hysterosalpingogram. And so this is an X-ray test where they inject dye into your womb so they can have a look and see if the tubes are truly blocked. If a HSG shows that your tubes are blocked, then there is some difficulty here, and I really want to explain this, and maybe I'm going to get into a lot of trouble with other doctors, but it's kind of important that we tell the truth. There is some surgery that can be performed to try and unblock the tubes. However, the success rate of that surgery is very, very small. It's extremely small. So you end up in a situation where sometimes you go to hospitals and they say, oh, well, we're going to do this surgery to unblock your tubes. And you're like, oh, great. but actually the success rate is very, very low. So if the tubes are blocked, then really the only choice, if you want to have a child if you want to have a child that is genetically the same as you, i.e. using your egg and your partner's sperm, then the only way to do that is with IVF. So IVF stands for in vitro fertilization. This is something that's taking off a lot more in Kenya, and there are some hospitals that offer it. It is a very expensive treatment, and it also only works generally around about 50% of the time. But what this involves is you going to a doctor where they'll give medications so that you ovulate at a very specific time, and then they collect the eggs using a medical procedure, and then they mix that with the partner's sperm, and then inject the embryo back into the womb. It is rather expensive, but if you're very, very keen that you want to have a baby that is genetically the same as you, then if you've got blocked tubes that are truly blocked, the best chance of you getting pregnant is to have IVF, is the answer to that question. Okay, so we're now back onto pregnancy. We are away from fertility questions. So the question is, what causes pressure in pregnancy? So I'm thinking you might mean high blood pressure. So when we're talking about high blood pressure in pregnancy, it's usually 2 months pregnant because the baby is only the size of a bean. So the baby doesn't need that much blood. So even if the connection isn't completely perfect, the blood flow is easy, no problem. But in the second half of the pregnancy, what can happen is the baby wants more blood every day. If you're looking at a growth of the baby, the first half of the pregnancy, the baby grows very slowly. And then in the second half of the pregnancy, the baby grows really, really fast. So in order to grow fast, the baby needs a lot more blood. But if the connection isn't completely perfect, sometimes then mum's blood pressure increases and pushes the blood towards the baby. So you get a rise in pressure. This is okay if it's just a little bit of high pressure, but sometimes people can get a medical condition called preeclampsia, which is really serious, where the pressure goes up and then the pressure inside the placenta builds up, the placenta starts getting tired, starts releasing all of these chemicals that causes you to become really unwell. So that's what preeclampsia is, and it sometimes happens to women who have higher blood pressure. So generally the cause of the higher pressure in pregnancy is usually related to the placenta. Sometimes as well, women have high blood pressure before they even started getting pregnant, so that might be why they have high blood pressure in pregnancy as well. But if we see a woman who's got high blood pressure, then that puts them into a sort of medium risk category, so we want to see you in clinic. If you know you have high pressure and you're out in the community and you haven't seen a doctor yet, you should come and see your gynaecologist, obstetrician to make sure everything's okay. All right? Okay, number 9. This question says, I am 12 weeks and 2 days pregnant. Today in the morning, I found myself nose bleeding. What could be the problem? So nose bleeding is really common in pregnancy. So when you're pregnant, you need blood for yourself, but you also need blood to give to the baby. And so the amount of blood in your body increases by a ridiculously high amount. So you might hear people saying when you're pregnant, oh, your skin looks so great, or you're glowing, you look really good. That's because you have so much more blood in your body, because your body, A, needs to give that blood to the baby, and B, then the body knows that when you deliver your baby, you'll lose some blood. So you have this extra blood in your body. What that means is your blood vessels are all a bit dilated. And so sometimes the blood vessels in your nose can get a bit dilated, and they can bleed. So a nosebleed is quite common in pregnancy. If it stops with routine things, you're just going to press on your nose and lean forward a bit, then that is usually okay. You really need to press quite hard on your nose for about 5 minutes to stop the bleeding. If your nosebleed is continuing, and you're beginning to feel unwell, then you might need to come to hospital in order to get reviewed and see whether you need to have something to stop that bleeding. But I must say, I've been doing this job now for about almost 20 years. I've never seen a woman have an intractable nosebleed. It's very unusual for a woman to have a nosebleed that won't stop with simple measures. So nosebleeds are common in pregnancy, and it's because there's more blood in your body. Okay, so the next question says, the scan says I am 36 weeks, but according to my periods, I am 35 weeks. Why is that? So not all babies are the same size. So it really depends on how much you weighed when you were born, and how much your partner weighed when he was born, to see how big your baby will be. So what we do is we do a scan at the early part of the pregnancy, that sort of 9, 10, 11-week scan, and that tells us what the due date is, and that's fixed. Once we know that's the due date, that is the due date. But then on your later scans, you might find that you're expecting to be 35 weeks, but the baby measures a little bit bigger or a little bit smaller. And that's just individual differences within the babies. So some babies are bigger and some babies are smaller. And that's okay. Not every baby is born weighing exactly 3 kilos. Some weigh 2.8, some weigh 3.5, some weigh 3.9. It's normal to have a baby that weighs between 2.5 kilos and 4 kilos. Sometimes the babies can be a little bit bigger than that, usually not that often. So generally, not all babies will be the same size. So if you think you should be 35 weeks and the baby measures 36 weeks, that's within normal. We say that whatever your due date is, the baby can measure anywhere within a week or 2 weeks of that date. So if you're 37 weeks, the baby might look more like 38 or 39 weeks, that's okay. As long as you're not having a situation where you're 32 weeks and then the scan says the baby looks like it's 38 weeks, then your baby is clearly much bigger than the baby should be. So a week or two's difference on either side of what your due date is not a really big difference. What we're doing at Jacaranda is having growth charts. So we have some charts that we're going to be distributing soon, that when staff see the patient, they can then mark on the paper where the growth is. And so you can look at your baby's trajectory, so you can see that your baby's growing normally. So sometimes it's really important, if you're not happy with the scan, you say, my data is totally different to what the scan says. It's important that you tell us so we can really investigate that. But generally, if it's just 1 or 2 weeks on either side, like if you're 35 weeks and the scan says 36 weeks, it's okay. More questions. So I am finding it difficult to breathe at 34 weeks pregnant. There are so many different things. Pregnancy is wonderful. It's it's a very interesting thing that's happening with your body. And everyone knows that when you're pregnant, you have a bump. And so people feel that that's the main change. But actually, the changes that are occurring in your body are so many. One of the changes is you need more oxygen, because you're using your oxygen, but the baby is also using your oxygen too. So sometimes, basically what happens is the body feels breathless in order to convince you to breathe more, because you need more oxygen. That's the kind of straightforward answer to it. But it's also to do with how wide your chest is. If you took a measuring tape and you measured a woman's chest at the beginning of the pregnancy, and then you measured at the end, you see that her chest is much, much wider. And that's in order to make the lungs bigger, to get more oxygen inside. So sometimes you feel breathless because you're pregnant. The other thing is as your bump gets bigger, your bump is pushing up against your chest, which means it might be difficult to take deeper breaths. So that's another reason why people feel short of breath. Now, that happens to most women. But what's important to remember is sudden changes. This is a general important thing in pregnancy. If something suddenly changes about you, such as you suddenly have a headache or you suddenly can't breathe, then that can be a problem. There's something called blood clots, a DVT or a PE. These are the kind of blood clots that you can get sometimes in pregnancy. They're very dangerous, but they're also very, very rare. But sometimes it can occur that you feel short of breath for that reason. Now, what is the difference there is for women who are short of breath in pregnancy, it's quite mild and it's quite gradual. You know, you'll notice as you get more pregnant, you get a little bit more tired, a bit more difficulty breathing. So if that's happening and it's a gradual, mild, it's just there, it's annoying, but it's been the same for a while, then that's okay. But if you're feeling completely fine and everything's okay, and then all of a sudden you're like, oh, I can't breathe, that is serious and you need to come to the hospital. So if something is suddenly changing about how you're breathing, you need to come to the hospital. The other thing as well I'd like you to check for the person who asked this question is to look on your antenatal card to see what your HB level is. So HB stands for hemoglobin. It's a measure of how much blood is in your body. if your blood count is very low, that sometimes can make you feel short of breath as well. So you're going to want to make sure that when you see your midwife or your doctor, you can ask them, hey, is my HB okay? Because that's also the reason. So when it comes to shortness of breath in pregnancy, 1, if it's mild and gradual, it's probably okay. 2, check your hemoglobin and make sure that that you've got enough iron in your body and your baby's not stealing all of your iron. And then question 3, if you suddenly change and you suddenly become short of breath, you need to come to the hospital, because sometimes there can be a problem, but that problem is very, very rare. So it says, is it safe to use nausea and vomiting tablets? I'm in my first trimester. The answer to that question is yes. Any medicines that we prescribe here are safe. So there are things like cyclizine, Nosic, metoclopramide, ondansetron. These are all medications that are used for nausea and vomiting in pregnancy. There's something called the FDA. It's an American organization. Sorry, one second. So there's something called the FDA, an American organization. They give international advice on whether drugs are safe in pregnancy. And most, if not all actually, I can't think of one that isn't, most anti-sickness medications are safe in pregnancy. I'm really struggling to think of one that is not safe. So if you're seeing a doctor and the doctor is prescribing anti-sickness drugs and you're pregnant, even in the first trimester, that's okay. It should be fine. So I did a scan at 20 weeks. Unfortunately, I didn't find the gender. What's the other best time? So basically, the longer you wait in pregnancy, the more likely it is that it'll be difficult to see if it's a boy or a girl. So if you had difficulty seeing if it was a boy or a girl at 20 weeks, you can try again at 22, 24. It's absolutely fine. A lot of the time, we're not blaming the ultrasonographer. A lot of the time it's your baby's fault. Your baby is shy. So your baby is maybe facing away from the ultrasound probe, or maybe the baby's crossed the legs, or the baby has pulled the knees up like this so that you can't actually see the genitals very well. So it's one of those things that your baby's being difficult, so we can't see the gender. But if you repeat the scan in about 2 weeks, you can look again, and probably your baby will be in a different position. Sometimes your baby's being really stubborn, but generally speaking, you want to try and do that scan before 28 weeks to repeat it and just check if it's a boy or a girl. Yeah, it's your baby being difficult. It's not. It's nothing to do with the ultrasound, people. So many questions coming through, which is great. So the next one is: can someone increase the chances of a normal delivery while being pregnant? So it's good to talk some figures so that you understand about normal delivery. So generally speaking, for women who are having their first baby, who are wanting to have a normal delivery, the chance of them having a normal delivery generally is around about 85%. So there's like an 85% chance generally that your baby will deliver normal across the world. If you went to every hospital in the world, generally 85% of women will have a normal delivery or a vaginal delivery. Sometimes we have to help with putting a cup on the baby's head. When it comes to the reasons why a cesarean is necessary, sometimes it can be because the baby's not happy during the labor, which we monitor for. And if the baby's not happy, we might have to do a cesarean section. And the other thing is if the cervix doesn't open. Now, labor is a really complicated thing that is difficult to predict. So sometimes the baby might enter into the pelvis at a funny angle. Maybe the head will be facing the wrong way or something like this. If that happens, then the labor can be longer and be less likely to be successful. And there's no good way of doing this. When it comes to having normal labor, the best thing you can do is be healthy. So to walk a lot. I advise people around the time that they want to get their baby, if they're feeling like, my due date has come and I still haven't gotten pregnant, then we advise them to walk a lot, because the more you're standing upright, the more the baby's head can engage a bit. So try to walk around a lot. But generally, it's all about being healthy. If you are, if you're a healthy person and you exercise a bit and do these sort of things, it's more likely your baby will be a normal size and things will be okay. But sadly, there is no way to absolutely make sure that you have a normal delivery. So I think the first thing to say is everyone should try to have a normal delivery when they can, because normal delivery is the safest for mum, for the baby. But sometimes it will happen that you need to have a cesarean, and it's not your fault. You can try your best. But it's something that sometimes the baby just makes a decision, I'm not coming out this way, and so we have to do what the baby says. People have this idea that you're coming to the hospital and people will do what the doctor says, but actually the doctors do what the babies say. And so that's kind of how it is. So you can try your best to be healthy, to walk around a lot, to really help your baby's head engage, but there is no 100% way to make sure you'll deliver your baby normally. So we have about 20 minutes left, so we're going to try and answer as many questions as possible. So where are we now? Okay, so it says, I am 37 weeks. I did a scan at 35 weeks and the cord was around the baby's neck. Can I deliver normally? So the answer to that question is yes. So it might seem a little bit scary when someone tells you the cord is around the neck, because we all value our necks. You know, our necks are very important. We need our necks. But really, in this case, that's because we're breathing. Me and you right now, we're both breathing in oxygen through our mouth and through our neck. But babies aren't doing that, okay? So babies are in water, so they're not breathing like me and you. The oxygen that the baby gets comes from the placenta and through the umbilical cord. And the umbilical cord can be wrapped around anything. It can be wrapped around the leg, around the arm, around the neck. It doesn't matter. As long as the blood is flowing through it, it's okay. Now, sometimes we see that if the cord is wrapped a number of times around the neck, sometimes during labor, when the contractions occur, the cord can get squeezed, and that can cause changes in the baby's heart rate. We also think this is normal because the baby's not breathing. Remember that the baby's in water. So it's okay for the heart rate to dip a little bit, but our job as midwives and obstetricians is during your labor, when you're having a baby, we closely monitor your baby's heartbeat and make sure your baby's heart sounds really good. And that really is what tells us whether you can deliver your baby normally or not. Your cord can be wrapped around the arm, the leg, everything. The cord can be wrapped around everything. And actually the blood is flowing perfectly and the baby's completely fine, and that's okay. So I wouldn't be too worried about the cord wrapped around the neck. It's okay. We will monitor your baby and make sure your baby's well, and if your baby doesn't seem so happy with labor, we'll stop. But generally most babies that have the cord around the neck, we see it all the time. I would say probably on average when I deliver a baby, I would say maybe 1 in 6 of them has the cord around the neck. It happens all the time. It's not really a big issue. So it says, how long should a newborn baby be basking in the sun? So I am not a pediatrician. I'm an obstetrician. So I know a lot more about pregnancy and while the baby's inside, and then I give the baby to a baby doctor to look after if there's a problem with the baby. So I'm probably not the best question to ask that person. Best person to answer that question. I would say generally a little bit of sunlight is good for babies, up to sort of 5 to 10 minutes every so often, because sunlight helps your body make vitamin D, and it also helps you break down bilirubin. So some babies are born with a little bit of jaundice, a little bit of yellowness, and sometimes sunlight can help with that. If your baby is jaundice, you're worried the baby's eyes look a bit yellow, you should come and get seen by a pediatrician, by one of our children's doctors. But generally sunlight exposure, you must be very careful, obviously, because babies have very sensitive skin. You don't want them to burn. So I would just say, you know, if you're outside and you're changing your baby's nappy and the baby is not wearing any clothes, it's okay for 5 or so 10 minutes to let the baby be in direct sunlight. But also remember, the baby's been in a dark womb for a really long time, might not like all that sunlight. So generally, I will refer to a pediatrician to answer that question, but I don't think it's a big issue. But a little bit of sunlight's okay, but don't let the baby, they have sensitive skin. So one of the questions here is back to fertility. It says, I'm not ovulating, how can I fix that? I need to get pregnant. So first of all, we want to know if you're definitely not ovulating. So we want to do some blood tests and be absolutely certain that you're not ovulating. And then to do some fertility investigations. Earlier on, we answered a question about a woman taking fertility tablets. Sometimes it's a good idea, if you're not ovulating, to take fertility tablets. However, these fertility tablets have risks. So it's really important that you come to see a gynaecologist who investigates what's wrong, and then afterwards we can make a plan about, if you're having difficulty ovulating, how to manage that. There are lots of different things we can try. One of them is fertility tablets, but there are other options too. So if you're having difficulty conceiving and you're worried about whether you're ovulating, just please come. We can talk. Okay, is it possible for an ultrasound to lie about the weight? That's a great question. So when it comes to ultrasounds, they are most accurate at the beginning of the pregnancy. So when you're starting the pregnancy, the margin of error is very small. But as your baby gets bigger and bigger, because of the way the ultrasounds waves work and the way that they travel through the water and how they're measuring the baby, the accuracy of ultrasounds gets less as the time of the pregnancy goes on. So up until around about 24, 28 weeks, the scans are really quite accurate. After that time, they get a little bit less accurate, but still not very inaccurate. So generally speaking, what I do is one of my jobs as the consultant here is I look back at all of the deliveries, make sure everything went okay, that sort of thing. And sometimes you'll see a woman who's had an ultrasound scan, and then the scan will say the baby's very big, and then when the baby's born, the baby is normal size. So scans can overestimate weight. It's possible. But generally speaking, when I look back at all the information, our ultrasonographers do a pretty good job, and we're usually within about 200 grams of the estimated weight. So if we say the baby's going to weigh 3.5, baby might weigh 3.7, might weigh 3.3, generally it'll be in the same area. So yes, the scans can lie about the weight, and that's a technological problem. It's not a person problem. All over the world, there are people who are, amazing sonographers, but they're actually working with a piece of equipment that is only so accurate. So yes, sometimes the weight is wrong, but it's usually not very, very wrong. It's just maybe by 100 or 200 grams. Okay, so there's that one. People are furiously writing questions, so I'm waiting for more questions. I will go back to one of the older questions just while we're waiting. One of the older questions is light bleeding normal at 6 weeks of pregnancy? So officially we say bleeding is not normal in pregnancy. So if you're having any bleeding, you should come and get checked to make sure things are fine. Something can happen called an implantation bleed, and this can usually happen in the first month after you get pregnant, where as your baby's starting to grow and the sac and the waters start growing inside the womb, they can push out a little bit of the lining of your womb, and you can get a little bit of brownish loss. These are implantation bleeds. They usually happen in the first 4 or 5 weeks. They're not terribly serious, but you might want to get checked out. But the blood isn't fresh, it's like brownish. But if you're having fresh bleeding, if it's obviously looking like a period, or if it's very bright red blood you're losing, then it's not normal and you should come and get checked out. If you're bleeding in the early part of your pregnancy, we want to make sure that the pregnancy is in the right place. This is really important. 1 in 100 women will have a pregnancy that's growing in the wrong place, and we call this an ectopic pregnancy. Ectopic pregnancy is very dangerous. So we need to know that if you're bleeding or having pain in the first part of your pregnancy, you should come and we should do a quick scan to make sure the pregnancy is okay. All right. So these are some more questions that are coming from... okay. What can I take to stop soil cravings at 34 weeks? Pica. It's an unusual thing. It's a thing that occurs in pregnancy called pica. People call it cravings, that you get pregnant and you think that all of a sudden I want to eat chocolate and mayonnaise together, or strange things like this. And for some reason, soil is one of those things that people sometimes really feel like they want to eat. It's usually a sign that you might have some iron deficiency. So you might want to come and get checked, and we do what's called a hematinic test to see whether you have enough iron in your body. So you would probably, if you're really feeling those cravings, then you want to check those things out and make sure your blood tests are okay. But if it's not that and everything's fine, you just need to find something else to eat, because soil is not so fantastic for you. But there's also things that contain iron, food that contains a lot of iron, things like red meat. Red meat is really good. And also the darker green vegetables, so things like sukuma, they're really, really dark green, and those also contain those things. And they also kind of taste a bit earthy as well. So try eating more red meat, more beef, and more dark green vegetables if you're trying to eat soil. But I understand, it's not crazy. Don't be like, something's wrong with me for wanting this. It's actually a fairly common feeling in pregnancy. I'm past my due date. Today I'm 40 weeks and 4. How can I induce labor? Because I'm tired. Okay, so when it comes to induction of labor, if you haven't seen your midwife in the last week and you're 40 plus 4, we're going to want you to come so we can book an induction of labor date for you. We can induce your labor at 40 plus 4. After your due date, it's okay to induce your labor. If you're feeling tired, that's okay. We don't want to induce you before your due date unless we have to. But if you're after your due date and you're feeling tired, we usually induce you up to 1 week before your baby's due. I want to caveat that. I want to make sure you're aware as well that if after this TikTok we had 5 women come and saying, "Oh, you told me I could have my induction today," that's possibly true. But you must remember we're running a hospital and we don't want to induce 5 women on the same day, because we have to deliver babies and we want to be able to pay enough attention to those babies and to those women. So if everyone turned up tomorrow and said, "Oh, I listened to Dr. Locke and he said I can have my induction of labor today," it's true you can be induced at the right time, but we need to schedule it so we space people out to make sure that we're not delivering everyone on one day of the week, because that's not safe for everyone. We need to make sure we control how many women are delivering so that we can give everyone the right level of care. Okay, this is an important one. I'm scared of giving birth. Can I book for a cesarean? So basically, when it comes to doing cesarean sections, what we want to do is for you to see the consultant. Now, the official line of Jacaranda Maternity is we only perform cesareans for medical indications. And the reason for that is really simple. When it comes to the negative things that can happen when you deliver your baby, cesarean is more dangerous than having a vaginal delivery. That's an absolute. When we look at outcomes for mum, babies, these sort of things, there are no major differences, but in cesarean section there are some serious things that can happen. So if a woman really wants a cesarean section where there's no medical indication, what we really encourage you to do is to tell us as early as possible in the pregnancy. So you're booking your pregnancy, you've just found out you're pregnant, you want to have a discussion and say, "Look, I really want to have a cesarean section because I'm afraid of giving birth." What we will then do is make an appointment with the consultant and have a chat through about the medical things, try and find out what your concerns are, and then go from there. Because we really want to individualize care. We want to make sure that every woman has care that is appropriate to her. But at the same time, one thing that's really difficult is when a woman gets to her due date and then says, "Oh, I want a cesarean tomorrow." It's not possible to run a hospital like that. Obviously, we schedule people weeks in advance for surgery and things like this. So we want people, if they want to have a cesarean birth for a non-medical reason, to tell us as soon as possible early in the pregnancy so that we can get the right people involved. The main thing is to do with risk. And I know this sounds a bit crazy, and sometimes your concerns about giving birth are stronger than what you think the apparent risks are. But it's really important that if you want a cesarean section where there's no medical indication, that you get to see one of the consultants to talk about it, to really take you through what the cesarean involves. This is the practical side of it, but there's also the personal side of it as well, which is we look after women if they have a normal delivery or a cesarean section. And we also know that women who deliver their baby normally, we see them on the ward the next day and they're walking around, they're happy, they're breastfeeding, they're not having any major problems. We also see there are women that have cesarean sections and they can have a much more difficult time looking after their baby because they're in pain, they've had a big operation. So in the balance of it, we just want to counsel and have a discussion. It is possible to book a cesarean at Jacaranda for maternal request, but it has to be that you've had consistent care throughout your pregnancy and that we're seeing you a number of times in the clinic to make sure that we've completely covered all bases and understood what we're doing. Because the truth is, if you have a cesarean section, the chances that things will go wrong are higher. And when they do go wrong, the first question we are asked is, was the cesarean needed? What was the medical indication? And then things become very challenging. So the answer to your question is, it's possible, but we want to see you many times in the pregnancy to really make sure the care is right for you. The next question says, can asthmatic mom go through? I'm assuming that's labour. The answer is yes. This is a short answer. Asthma is not a contraindication to giving birth normally. Also, there are no asthma medications that are not safe in pregnancy. Salbutamol, salmeterol, prednisolone. Montelukast, cromoglycate, all of these different medicines you take for asthma are all safe in pregnancy. So they should be prescribed by a doctor, but your asthma can be very well controlled. It's not going to be a problem. Right. How was this the next one? Yeah? Okay. The next question is, can the baby only be active on the left side? No. The answer to that question is no. The baby can be active upside down, left, right, doesn't matter. We encourage people not to sleep on their backs when they're pregnant, okay? Because when you sleep on your back, your bump will press against the blood vessels in your tummy. And that means the blood flow in your legs gets slower. So then generally your circulation is not so good. So we want you to lie on your left or your right. It doesn't matter which. Some people say the left is better generally, but actually can be the right as well. It's fine. But just don't lie sleeping flat on your back. Okay. So again, we talked about this one a little bit earlier. It says, I had a miscarriage and my right side hurt. What could be the problem? So we talked about ectopic pregnancy. So if you're in the early part of the pregnancy and you start having pain and bleeding, and the pain is more on one side than the other, that makes us worry the pregnancy might not be in the right place. So I would do a scan. Okay. It says here that this person unfortunately had a miscarriage. If that's been confirmed by a doctor or by a nurse, then okay. If you think you've had a miscarriage and you're in pain and you haven't seen a medical professional, you should see a medical professional. Because if you're in pain on one side more than the other and you're pregnant, it could be in the early part of the pregnancy that the pregnancy is in the wrong place and that it's still inside. So if you're not feeling well, you need to come. This says, I have cramps immediately after my period. Does it mean I'm pregnant, associated with bloating and discharge changes? It might do. Usually your womb is growing when you're pregnant, so sometimes you can get a few little cramps. That's fine. Bloating can also be a sign of feeling like you're pregnant as well. I would say the answer is wait until your day of your period is expected, and if it hasn't come within a week, then maybe a week later do a pregnancy test and see if you're pregnant. But it's very difficult to tell without a pregnancy test whether you're pregnant or not. Chances of getting pregnant after ectopic, that's a really good question as well. These are great questions, guys. So when it comes to ectopic pregnancy, usually when you have the surgery, one of the tubes is removed. So your chances of getting pregnant are slightly reduced when you're looking at someone's fertility. If you imagine a woman with normal fertility has 100% fertility, a woman who's had an ectopic pregnancy has 90% fertility. So it doesn't mean you can't get pregnant, it's just slightly reduced. The one ovary which has been blocked because the tube has been removed when an ectopic is removed, the other ovary just kicks in and ovulates more frequently. So generally your fertility is reduced a little bit after an ectopic, but not so much. The important thing is when you do get pregnant and you have a positive pregnancy test, we want to make sure that we know about you early, because we really want to get a scan done at the right time to make sure that this pregnancy is not ectopic, that this pregnancy is not in the wrong place. So we just have a few minutes left. I'm going to try and do 2 or 3 more questions. Right, okay. It says here, advice for a 44-year-old lady, is it safe to get pregnant before thinking about stopping contraception? Yes, it is safe to get pregnant. There is a Jacaranda, particularly when Ruaka opens in a few weeks, we're going to be also running a pre-conception service. So please tell all your friends about this as well. If you are a woman who is not pregnant but who's thinking about getting pregnant, but there's something on your mind, then we want to see you before you try to get pregnant. So some women, let's say a woman who's 44, she might know that there may be some difficulties getting pregnant, or she may have some other medical problems. So it's a good idea before you stop taking contraception, if you're planning on getting pregnant, that you come and see us before you get pregnant, just for a simple consult. This is true for people who are over, let's say, the age of 40, women who have had previous problems getting pregnant. So if you've had lots and lots of miscarriages in the past, we really want to see you before you try again. so we can try and help you. And then there's another thing, which is my specialist area that I'm very interested in, and this is to do with maternal medicine. So if there are women out there who have medical problems that they have to see a doctor for regularly, like diabetes, high blood pressure, epilepsy, kidney problems, some rare autoimmune problems, anything that is something that's affecting your entire life, you might have questions about, can I get pregnant? What will happen in my pregnancy? How is my pregnancy different? And that's what my particular specialist area is in. So we're starting up a clinic at Jacaranda, which is specifically meant for women who are not pregnant, who want to get pregnant, but there are some things they're worried about. And so they want to come and speak to us before they get pregnant. Okay, so that's there. And I think we're going to move on to the last question now. What does, I don't understand that. Forgive me. What can be the cause of losing pregnancy after what? After 7 weeks. Okay. So that was something we were just talking about. So this is the last question. Not a fantastic question to end on, I know, but it's something that affects many women, and we have to make sure we can talk about it. Is what the question that the person asked was, what is the cause if I keep getting pregnant but I lose the pregnancy in the first part of the pregnancy, in the first 7 weeks or so? If it happens more than twice, if you've had 3 miscarriages in the early part of the pregnancy, we call this recurrent miscarriage. And at Jacaranda, we also have a recurrent miscarriage service. So you can see one of the consultants and we can talk about what the causes can be, counsel you through what happened before, and then talk about if you need any further tests and things that we can help you. There are many, this happens to quite a few women, that they keep having miscarriages in a row. Most of them will just get pregnant again and everything will be fine. But some women do have medical conditions, which mean that it's a bit difficult. So final plug, because this is probably the end of the thing now. But generally, you should know that Jacaranda has 2 hospitals right now, one at Kahawa West and one at Umoja. I work at both of them, and so does Dr. Doreen. And then there's a new one which is opening in Ruaka soon. And what we're aiming for Ruaka to do is that 1 day a week there'll be a special clinic run by me and by Dr. Doreen, and that clinic is aimed at women who are having difficulty getting pregnant, women with recurrent miscarriage, women with medical problems before they get pregnant, and also general women's health issues, things like painful periods and things like this. So hopefully when Ruaka opens, we'll have this special clinic day once a week that you can come and see us and talk about the things that are worrying you if you're not pregnant. But the rest of the time, we obviously are seeing people who are pregnant too, and they go from there. So I think that's going to be the end of the session today. It's been great answering your questions, and hopefully we'll have a chance to do this again in the future. But if you have any further questions that you want to address, then come to the hospital. All of our doctors can answer your questions, as so can your midwives. They're also brilliant. So thank you very much.